Welcome to The Explainer. Okay, you're at the counter, you have just a few minutes, and the counseling you're about to give could literally change a patient's life. Today, we're going to build the perfect counseling guide for a new epilepsy diagnosis, focusing on the key conversations that really, truly matter. So we'll break this down into 5 essential conversations, kicking things off with understanding the diagnosis, then jumping into starting medication, managing those pesky side effects, lifestyle changes, and finally, some absolutely crucial points on women's health.
All right, first up, understanding the diagnosis. This is the foundation, right? This is where we can replace a patient's anxiety with some real clarity.
Picture this. A patient is standing in front of you, just got this diagnosis, and they're scared, they're uncertain. The single best tool you have to cut through that anxiety is a clear, simple definition that demystifies this whole thing right from the start.
Here is the key distinction you have to make for them. Epilepsy isn't about having a seizure. It's about the brain having a predisposition to have more seizures without a specific trigger. Why is this so important? Because that simple clarification helps them immediately understand the need for consistent, long-term treatment. It's not just some one-off event. And explaining this difference can be a huge moment of relief for patients. When you clarify if their seizures are focal or generalized, you're helping them make sense of what's happening to them. It explains why they might get a warning, that aura, or why a seizure might seem to come out of absolutely nowhere. It validates their experience. Okay, next up, let's talk about starting that medication for the very first time. This part is all about setting the right expectations. So when we start an anti-seizure medication or ASM, we all know the mantra, start low, go slow. But listen, this isn't just a clinical rule, it is your most important tool for getting patient buy-in. When you explain that this careful titration process is designed specifically to minimize side effects, it helps manage their expectations and encourages them to be patient while you find the right dose together. This is such a critical safety check. Explaining to a patient that a medication that works perfectly for one type of seizure can actually make their seizures worse, that's a powerful counseling moment. It really reinforces why getting that precise diagnosis is so important, and of course why they should never, ever share their medication. So, once therapy is up and running, the conversation naturally shifts, right? It becomes all about managing the day-to-day experience of being on an anti-seizure med. Come on, we've all heard this exact complaint. Side effects like dizziness, fatigue, maybe even ataxia, that difficulty with coordination and balance, they're incredibly common, and patients often think they just have to put up with it, but they don't. And this is where you get to turn a patient's complaint into a real collaborative plan. By offering practical solutions, like suggesting they take their dose at bedtime or ask their doctor about switching to a slow-release formula, you give them a sense of control over their own treatment. Now, our job goes way beyond the pharmacy counter. Counseling on lifestyle is absolutely essential for optimizing their quality of life. This is all about living well and living safely with the condition. These tips are all about small changes that can prevent major accidents. Simple things like explaining how sleep deprivation can actually lower their seizure threshold, or advising them to use the back burners on a stove. That can dramatically improve a patient's safety and give them the confidence to live a fuller life. Okay, let's turn to a particularly high-stakes area now. This is a space where your guidance as a pharmacist is absolutely critical. Counseling women with epilepsy, especially when it comes to contraception and family planning. Anti-seizure medications basically fall into 2 main camps. You've got the ones that are enzyme-inducing and the ones that are not. And understanding this one distinction, well, it's the key to one of the most significant and preventable drug interactions in all of pharmacy. And here it is. This is the non-negotiable bottom-line message. Enzyme-inducing anti-seizure medications can cause hormonal contraceptives to fail. For any patient of childbearing age who is on a drug like carbamazepine or phenytoin, this is arguably the single most important piece of information you can give them to prevent an unplanned pregnancy. Now, for patients who are planning a family, this checklist is just indispensable. Being proactive, discussing things like avoiding valproic acid, starting high-dose folic acid early, and aiming to be seizure-free before conception, this empowers them to partner with their entire healthcare team to plan for a safer pregnancy. Well, the answer is right here, in these conversations. Our role isn't just to make sure patients take their medication correctly. It's to give them the knowledge and the confidence to live well with their condition. That is the real power we have behind the pharmacy counter.